Recognize the gentleman from Georgia, Mr. Loudermilk.
Thank you, Mr. Chairman, and thank all the members of the panel for being here. Dr. Burke, you mentioned that the member of the National Academy of Sciences, you've made recommendations for IRIS for some reforms. Did I get that right?
Yes,
okay.
a 2009 report.
Have they followed through with those reforms that you've recommended?
They are moving forward, and yes, in a very responsive way, but the reforms are challenging. There are inherent uncertainties in the science and very often a lack of scientific information that make it challenging, but I'm very satisfied and have been part of pushing them to do just that.
So those recommendations for 2009, 2017, they still haven't implemented. How much are you projecting how long it's going to take?
I can't speak for how the program is going now, but I know that it was a focus of my efforts to improve that program, and they have implemented tremendous improvement.
Okay, thank you. Dr. Mundt, in 2017, the GAO in their high-risk report set out numerous recommendations for IRIS. Others have as well. To your knowledge, has EPA established timelines for the different stages of the assessment process since the GAO report?
I've not seen any.
Okay. Dr. Buss, do you know?
No.
Okay. I wouldn't expect if in 2009 they haven't made significant progress in the other recommendations they've done anything. Dr. Buss, the 2017 GAO report also indicates that excuse me, other EPA offices do not exclusively use IRIS assessments for information on toxicity. The use of alternative sources for toxicity information begs the question, are there in fact other sources better equipped to provide information IRIS assessments do not? And are these sources able to make up for our shortfalls? So it appears that EPA doesn't even use its own data. Are you aware of that?
Most of the science that the EPA considers in terms of its chemical evaluations is science coming from other sources. They do have their own Office of Research and Development, but the vast majority of the science that they ultimately end up incorporating into their assessment comes from either industry sources or from primarily the academic environment. So those are the primary sources of the science that they use.
I guess what is IRIS used for if EPA typically doesn't use it?
The primary purpose of IRIS is to pull together their IRIS evaluations, the objective of which is to develop what they call reference concentrations. So these are concentrations which they believe the public can be exposed, the science says the public can be exposed to without reasonable concern for harm. And likewise, they also do cancer evaluations to say at what level of exposure is it acceptable where you might not be vulnerable to having cancer as a consequence of exposure to this agent. And that's where the debate often comes in with respect to IRIS evaluation, because there, the studies that you use as the basis for making those determinations for those key values, the reference concentrations and the reference doses and the cancer values are really what drive the regulatory action. So by way of example, Dr. Burke mentioned one of the things that an emergency provider immediately would ask in the case of a chemical release associated with a hurricane, by way of example, is there a reference concentrate, an acute reference concentration associated with this material? So if people happen to be exposed to the vapors or a first responder is exposed to the vapors, what do we know about the potential for that to cause that harm? So having that value is useful if you can measure it at the same time. Now, it's also fair to say that the agency is not the only agency, and here's another issue regarding redundancy. The National Academy of Sciences has an extensive battery of what they call acute emergency guidelines. They have an entire committee devoted to saying in these acute circumstances, like chemical releases associated with these natural disasters, the first responders can consult the EGLE values and to say, what can we expect, as a consequence of exposure to the first responders and then ultimately to the surrounding population as well. So not having the IRIS there for those acute responses is certainly covered by other areas in the risk assessment community. So, for instance, the National Academy of Sciences and their EGLE values.
Okay. Dr. Mundt, is IRIS in need of major reforms, or is it duplicative now that we have other resources like Dr. Buss has brought up?
Well, the range of products IRIS produces is broad. It not only includes the reference concentrations, but it's one of the main organizations, the other being the National Institute for Environmental Health Sciences, the National Toxicology Program, for classifying substances as carcinogenic. So there's another area where there's some redundancy. I think one or the other could do this, but in every case, it ought to be done well with high-quality science. So I don't think that all of the functions of IRIS currently could be absorbed by other organizations.
But we do
The
agree
gentleman's
that
time's
need of major reform.
It's clear that there are major reforms underway because the problems have been recognized. Whether and at what rate they'll be implemented is yet to be seen.
Thank you, Mr. Chairman.
Thank you. Chair